Simplified H1 receptor summary for memorization. Histamine H1 receptors are responsible for bronchoconstriction, narrowing of the airways, increased mucus production in the lungs, vasodilation, and increased vascular permeability, which can cause swelling, itching, pruritus. USMLE Question 1. A 25-year-old woman comes to the emergency department with difficulty breathing and widespread itching after eating shrimp. She is found to be hypotensive and has bilateral wheezing on lung exam. Which of the following best explains the physiologic role of histamine in this patient's symptoms? A. Activation of H2 receptors causing smooth muscle contraction. B. Inhibition of acetylcholine at nicotinic receptors C. Activation of H1 receptors leading to vasodilation and bronchoconstriction. D. Increased norepinephrine release from sympathetic terminals. E. Inhibition of mast cell degranulation by IgG. Correct answer C. Activation of H1 receptors leading to vasodilation and bronchoconstriction. Explanation. Histamine released during an allergic reaction binds to H1 receptors, causing bronchoconstriction, vasodilation, increased vascular permeability, and pruritus. These lead to wheezing, swelling, and itching as seen in anaphylaxis. A is wrong. H2 receptors primarily stimulate gastric acid secretion, not smooth muscle contraction. B is wrong. This describes nicotinic blockade, not related to histamine. D is wrong. Histamine does not directly increase norepinephrine release. E is wrong. IgE, not IgG, mediates mast cell degranulation during allergic responses. USMLE Question 2. A patient with seasonal allergies complains of sneezing, runny nose, and itchy eyes. His symptoms improve with an over-the-counter medication that blocks histamine H1 receptors. Which of the following side effects is most likely due to this medication's mechanism of action? A. Increased stomach acid secretion. B. Excessive sweating. C. Dry mouth and sedation. D. Bronchodilation and tachycardia E. Muscle rigidity and tremor. Correct answer C. Dry mouth and sedation. Explanation. First-generation H1 blockers like diphenhydramine not only block histamine H1 receptors, but also cross the blood-brain barrier and block central cholinergic receptors, causing sedation and dry mouth. A is wrong. This is a function of H2 receptor activation, not a side effect of H1 blockers. B is wrong. H1 blockers do not cause increased sweating. In fact, they reduce secretions. D is wrong. Bronchodilation is not a typical effect of H1 blockers. Tachycardia is more associated with beta agonists. E is wrong. These are extrapyramidal symptoms seen with dopamine antagonists, not histamine blockers. Would you like me